Good morning, everyone. Thank you for joining us. My name is Ben Luciotti, Medicare Specialist here at URL Insurance Group. Really excited today to be joined by Aflac, Samantha Robertson, and Rachel De La Pena, joining us this morning to talk about Aflac's ancillary products, contests that they're doing as well. And I think what's great about ancillary, I feel like ancillary products don't get the love that they deserve because being in the Medicare space, it's solely focused on Medicare stuff. But um, really good to have these products in your portfolio to add on to some of the holes that Medicare doesn't cover. So really excited, and thank you guys for being here with us today, Sam and Rachel. So I'm going to turn it over to you guys. You have the floor. And just a quick note before we start, please feel to fire away and ask questions in the chat. We'll answer throughout and at the end as well. So again, thanks for being here, everybody that's on the webinar. And Sam, the floor is yours, and Rachel as well. Thanks so much.
Thanks, Ben. I appreciate it. Good morning, everyone. I hope everybody is having a wonderful day so far. We are one day closer to Friday, so that is always good. As we get started, we're going to cover the ancillary products Ben mentioned. That includes the Aflac dental, vision, and hearing, and then our more traditional products such as our accident, cancer, and critical illness. It's been mentioned as we go through. Please feel free to put any questions that you may have in the chat. And then we also have some time built in at the end of this to go over those questions or provide any clarifications that you may need. It is storming where I am, so just in the it gets cloudy. I live in Georgia, so some of the technology advances, not in Atlanta. So I'm going to go off camera just so it doesn't impact the bandwidth or cause any lag or delay. I will come back on once we get into the question and answer section. But as we get started, I wanted to provide you guys all with just some general Aflac information. This is some of the information that we get a lot of questions on. Just, who do I contact? What about dependents, payments, coverage? I've decided to consolidate that into just this one slide because it is universal for all of our policies. So the first is going to be, customer service for policyholders. If you do sell an Aflac policy, who can they, what's the contact information for them to call if they have a question about their policy or for customer service? So you can see that's the first number up there, the 866-990-2668. Then for agent support. So if you have a question about your licensing or appointment with Aflac, or if you need technical support from the platform perspective, so if you can't get through or you're getting some kind of error screen or you need help with something, you can email t1agentsupport@aflac.com. And then for policyholders, once they have an application that has been submitted, or they have an active policy, they can manage their account online by going to myaccount.aflac.com. It's not aflac.com, it's my account. The direct-to-consumer customers have a separate portal than just your traditional aflac.com. So if they go to aflac.com, they would eventually be redirected here, but just for a good customer experience, we want to make sure that we get them set off in the correct direction. But that's where they'll go not only to file claims, but they can update their contact information, change their billing information, change their payment date, change address, so fully manage their policy at myaccount.aflac.com. There are children on policies, which I know a lot of times with just your demographic of customers, most of your plans would probably be like individual or insured and spouse, but children can remain on policies up to the age of 26. That's for all of our plans. We do accept all payment methods, meaning card or ACH, not all like Apple Pay and those kind of things one day. But we do accept Visa, MasterCard, Discover, American Express, or ACH using a routing and account number, either through checking or savings. And then the coverage options. So all of our policies can include just coverage for the individual, them and their spouse, single parent family, or two parent family. So just wanted to kind of put out the general information regarding Aflac because this does apply to all of the policies. First, and then we're going to go into, I mentioned we're going to talk about the dental and then accident, cancer, critical illness. I talk about the dental first because it is the only traditional network plan that Aflac offers. So this dental plan is a true network plan. It's the only plan that Aflac has where the customer will actually receive an ID card. They give that card to their provider. Then their provider is the one that submits the claim and gets, paid back. So this is the type of dental plan where if somebody says, hey, I want to go get my teeth cleaned twice a year, or, if I have a cavity or, need some dental work, my dentist submits the claim and I just pay the difference. That is what this plan is. So it is more of your traditional network dental plan. Now, the dental plan can be sold to anybody between the ages of 18 to 99. So there is no age restriction up to age 99. The coverage is guaranteed renewable for life, just like all of our policies are. And so guaranteed renewable for life means once they have the policy, as long as they are paying the premiums, they can keep the policy for as long as they live. But 18 to 99 for dental. It does start as low as $20 per month for our basic plan. You're going to have 3 plan options. You're going to have a basic, core, and elite. Basic being, the lowest price point, and then core kind of be in the middle of the road, and then elite being the highest coverage, but also the highest price point. With all 3 plans, preventative services are covered immediately with no waiting period. That does include 2 cleanings per year and 1 set of x-rays. And then basic services are covered after 6 months. Major services are going to be covered after 9 or 12 months, depending on which plan that they received. The availability, it is available in most states. I would not rely on this for the availability. And the only reason I say that is we get products approved pretty frequently from that state's DOI. So once a product is approved, it is available. The nice thing is in the enrollment platform, all that you need to give a quote for somebody to start the actual quote and enrollment process is you need to put in their state that they live in and their age. And what it will do is it's only going to show you the products are available based on that state. So if like right now it says that it's available in all states except for Virginia. Well, if Virginia approved dental today, when you go in tomorrow and you put in the person lives in Virginia and they are 68 years old, it would show the dental product tile for you to quote and enroll. So always lean on the actual platform for what's available and what's not. These slides can become outdated in about a 24-hour period. The network with our dental plan is listed here, but any dentist that is already a network with NovaNet, Dentimex, Zealous, Mavers, they're already included in with the Aflac Dental Network as well. So it does include tons and tons of doctors. I'm going to say it was over, I think, 100,000 dentists within the US, but it's a pretty large network. And we already talked about the coverage options that are available. The preventative care, this was actually kind of a snapshot from our enrollment platform. So I would, again, always refer to that actual platform before quoting actual benefits to somebody, because just like with everything else, there could be some variation based on the state that they live in. When you're giving a quote or looking at the plans, once you put in the state they live in and their age, you can be sure that the information on your screen at that point is what is available to them and the correct benefits based on their state. But in general, these are going to be the benefits for the dental plans. We talked about preventative services are covered at 100% with no waiting period. Basic services are covered after 6 months. Unfortunately, we cannot honor waiting periods that have been met with other carriers. So there's really no situation in which we would be able to withdraw or a waiting period. So every person that purchases a policy is going to have that 6-month waiting period for those basic services. After that 6 months, basic services are covered at either 50 to 60%, depending on which plan they purchased. And then if they purchase a core or elite, the coverage amount for those basic services will increase in those first 3 years. Major services are going to be things like crowns, dentures. Those are not covered under a basic dental plan, but they are covered under our core and elite plans. It's not a typo. The core, which was that middle of the road plan, does have a 12-month waiting period for those services, and then they're covered at 50%. The elite only has a 9-month waiting period. Those remaining 3 months of that first year, major services are covered at 30. Starting in year 2, major services go up to 50%, and then in year 3, major services are covered at 70%. Our dental policy does not provide coverage for dental implants or orthodontics or braces. So those would not be considered payable services under a major dental service. So dental implants would not be covered. It would include things that said dentures, crowns, oral surgeries, those types of things. The deductible will decrease in the first 3 years, starts at $75, then goes down $25 a year till year 3, which lands at $25. And then the annual maximums, and that is going to be per person. The annual maximum is going to be based off which plan that they purchase, anywhere between $750 to $1,500 in that first year. Then the annual maximum will also increase in those first 3 policy years. And when you see this tiered approach, what Aflac tried to do was the policies are very competitively priced, but we wanted to incentivize people not only to buy a dental plan, but also to keep it for at least 3 years. And so that's why you see in those first 3 years, every year there's a slight increase to the policy benefits, like the percent that's covered, the annual maximums, and then a decrease to the out-of-pocket expenses like the annual deductible. So we wanted to price it to where people would be, could afford it, but then also incentivize them to keep the policy for at least 3 years. And so that's why you see that tiered approach when it comes to our dental plan. For vision and hearing, the vision and hearing can be added if somebody purchases a core or elite dental plan. The vision and hearing do come as a package deal. So they can't get one and not the other. If they get vision, hearing automatically tags along, and vice versa. So the benefits for each just depend on which dental plan that they purchased. If they are purchasing a core dental plan and they want to include vision and hearing, then they get for vision a $150 allowance every 24 months. It's a rolling 24 months to use towards corrective lenses. And they can use that towards glasses, contacts, frames, whatever they want. So it's a very simplified vision plan rather than list out, there's this benefit for this type of frame or this type of lens or coating. It is just all bucketed together and said you get $150 to use on a rolling 24 months for whatever corrective lens you prefer. The actual eye exam itself does have a $10 copayment, but that's all for the eye exam. And then for hearing, there's a $500 a year benefit for hearing aids. That includes either a new set of hearing aids or the repair or maintenance of existing hearing aids. So if you're talking to somebody and they already have hearing aids, they could use the hearing benefit from this to, service their existing hearing aids after the 12-month waiting period on the core plan. If they purchase an elite dental plan, the benefits are the same, except they get $250 for vision to use on a rolling 24 months. So instead of $150, it's just an extra $100 to use towards whatever corrective lenses that they want. And instead of that 12-month waiting period for the hearing aids, it would only be 9 months. So for the hearing aid benefit, the waiting period is going to match whatever the major services waiting period is on the dental plan. And so just a reminder on the dental, orthodontics and implants are not covered. This is the only kind of traditional or network plan offered by Aflac, to where they will get ID cards, and it's the dentist that typically files the claim, and then we just pay the dentist back. There is a no tooth or a toothless clause. Depending on the carrier, it's worded different ways, but what that really means is you need to, in order to purchase a policy, somebody needs to have at least one natural tooth in their mouth. So if they do not have any natural teeth, this policy would not be beneficial to them. So you want to make sure that they have at least one natural tooth in their mouth to purchase this policy. Also, another variation by carrier can be the dates, right? If there's like an annual maximum or deductibles like ours have, when does that reset? Ours is based off policy year, not calendar year. So if somebody were to buy a policy and it went into effect June 1st, then their deductibles, their annual maximums, waiting period, all that would reset on June 1st of next year, not on January 1st. So ours is based on the policy year, not calendar year. We already talked about the waiting periods. Those, even if they're met with other carriers, we could not waive those for any reason. And then we do recommend, when possible, for customers to wait until they get their ID cards in the mail before they go to their dentist appointment. They will have coverage on whatever the policy effective date is, but it'll just make the entire process a little bit easier if they have that ID card in hand when they go to the dentist. And I say that because in that scenario, if somebody had a policy and it went into effect June 1st, June 1st falls on a Sunday, I believe, their ID cards wouldn't even be mailed out until like June 2nd. So they should get them in the mail within, 3 to 5 days, but it's just going to make that claims process easier. If they went to the dentist on June 2nd, which some people will, we know that's unavoidable, they would absolutely still have coverage. It would just be a few extra steps for that provider to be able to verify or get the coverage. So we do recommend just waiting if at all possible. So let's see. I didn't see any questions pop up in regards to the dental, which is great. That just means you guys are comfortable with the dental, or I'm just doing an amazing jam up job. I will take either one of those answers as sufficient. And next, we're going to talk about the ancillary products. And these are more traditional Aflac products. Before we get into these accident, cancer, and critical illness plans, though, what I like to do is just give a brief Aflac overview, right? Because almost everybody on the planet, right, has heard of Aflac. We have like over 85 to 90% brand recognition, meaning they've heard of the duck, they've seen one of the commercials, they've watched some type of sporting event that's been sponsored by Aflac. So almost everybody knows who Aflac is, right? Yeah, it's an insurance company. They have a duck mascot. When it comes to what does Aflac do or how does it work, that is where a lot of the confusion comes in, and just something, frankly, I just think as a company, we could have done better, and we've got to start doing a better job at. But with you guys as the agents kind of talking about Aflac to your customers, you want to make sure that you have just a very high level basic understanding of what Aflac is, how it works, and the concept. Because once you get the concept, the products really then become interchangeable. And so I've broken it down really into a very quick, like 6-step thing of how Aflac works. We are going to talk about the 3 different products, right? Our accident, our cancer, and our critical illness. And for this particular example, I'm going to say like an accident. So if somebody purchases an accident policy, so they purchase an accident policy and then a covered event happens. A covered event can be a catastrophic accident. Absolutely. Right. A lot of times what happens, just in my opinion, from 24 years in sales and doing this, is a lot of times these policies can be portrayed as catastrophic coverage, right? A lot of times people go through most of their life without any type of catastrophic event. The nice thing with these policies is that's okay. So a covered event could be a really bad car accident. But it could also be things that happen every single day. It could be a slip and fall. I lived in the Northeast for years. Every time I fell, the ice always beat me. As people age, those types of falls can become more serious. They can have, more repercussions. It's harder to heal. It can cause more severe injuries. So it could be slip and falls. It could be tripping downstairs. It could be burns. We just had Memorial Day weekend. Pretty sure somebody somewhere went to an emergency room because there was a firework mishap. So it could be trying to emulate the Hell's Kitchen show and ended up needing stitches from trying to cut something up in a kitchen. These are all injuries that happen every single day. Maybe not, they're not catastrophic, they're not life-changing, but these are all injuries that are covered under an accident policy. So any type of accident, injury that you get because of an accident is covered under an accident policy. So if somebody purchases the accident policy, and I'm just going to use myself as an example because I don't mind sharing probably too much of my life. No, so I have an accident policy. Years ago, it was a Friday night. I was on my way to meet some girlfriends for, drinks, dinner, little girls' night out. I left my house probably around like 7:30. I had a 2-level deck outside the back of my house. I was walking down the stairs and rolled my ankle, I guess. I don't know what happened. The next thing I know, I am laying at the pavement at the bottom of the stairs. My shoe went flying in one direction. I went flying in the other. My purse was thrown across the yard because it just went flying as well. But I fell down the stairs and ended up breaking my foot. It was a Friday night. I don't know if you've ever been to an emergency room on a Friday night. I tried not to go to an emergency room. So I looked at my watch and I was like, if I can get to the urgent care, they close in 30 minutes. I can still make it. Somehow, even with a broken foot, I managed to gather most of my belongings. Now, keep in mind, my arms were all scraped up from where I tried to brace myself from the fall. It was like bleeding down my elbow. Still determined not to go to the emergency room. Hobbled around, got my purse, the rest of my belongings, found my shoe. Luckily, it wasn't my left foot, or it wasn't my right foot that I primarily drive with. It was my left foot. Managed to drive myself to the urgent care. Got there about 15 minutes before they closed. I was probably not, their favorite person. They see me hobbling in, all, bloody and like, I've hurt myself. Like I've hurt my foot. Anyway, they take me back, do the x-rays. Turns out the foot was broken. They referred me to an orthopedist because they're like, we don't know if it'll require surgery or not. So they just wrapped it and put me on crutches for the weekend. So it wasn't catastrophic, right? I didn't require days in a hospital. It was just your everyday kind of broken bone. Later that week, so it ruined my Friday night plans. But later that week, I went to the orthopedist. Good news, I did not require surgery. They put me in one of those little walking boots. I was in that walking boot for, I don't even remember now, maybe a month or two, however long it takes. And then the boot came off. Right? I did have crutches for that one weekend. They were horrible. They hurt. I didn't know. They told me you needed better upper arm strength than I have for crutches. But not a catastrophic event. I also luckily have really good health insurance. So when I have this up on the screen here, that covered event happened, meaning I fell down the stairs, right? It resulted in a broken bone. I went and received treatment, all right? I drove myself to the urgent care. When I got to urgent care, I gave them my insurance card. For your customers, that could be like a Medicare card. Mine was, we have Blue Cross Blue Shield. I gave them that card. I paid maybe a $50 co-payment for urgent care. I paid that. Everything else was covered. And then I went home that same night. I did follow up the next week with the urgent care or with the orthopedist. So I think I paid like a $35 co-payment for that. He said I didn't need surgery, wrapped it, sent me on the way. So all in all, my total out-of-pocket expenses, because I am lucky enough to have really good health insurance, was less than $100, right, between the two co-pays that I had. But once I was like, okay, I don't need surgery. All I have to do is wait on my foot to heal. And that's what would happen with our customers, right? They're going to go get the treatment they normally would get in the event of an accident, whatever that looks like. And then when they start the recovery process, that is when they can go online and submit their claim directly with Aflac. It's a very easy, user-friendly process. I think I logged in. It's going to ask a few questions about who was injured, the date of the injury. So I put in like the date it happened and where I received treatment. I had that from like the paperwork they give you when you left. So I put the name of the urgent care. I went ahead and put that I had the follow-up visit with the orthopedist, like their information, and hit submit. When you hit submit, what it does, it asks for then where treatment was received and who the provider was, because we can verify a lot of that information through online databases. So we can just confirm, okay, she did have a broken bone or this was the injury. And in the physician's notes, it's going to have the cause, right? It was because of a fall. So all of that information was available. I think I submitted that claim on, let's say maybe it was the following Monday. The money then is direct deposited into their account, usually within 3 to 5 days. And then they use that money however they want to. So I think I submitted the claim on Monday. By that Friday, I had the money in my bank account, and then that money can be used for whatever you want it to. For me, I think the total payout, because it paid for the actual broken bone itself, there's a benefit for going to the urgent care or emergency room. There was a benefit for them doing the imaging, for the crutches, for the walking boot, the follow-up. All in all, I think I got about $800 from Aflac. Now, that's not a life-changing amount, but when my total out-of-pocket expenses were less than $100, to get $800 from Aflac wasn't a bad day, right? So it just paid for my drinks the following weekend when I was able to actually go out and, have my little girls' night out. Paid for all of our drinks. So we talk about a lot of times with Aflac, you got accident, cancer, critical illness. We can describe it as this like catastrophic event, but it's also good, especially with the accident, for these little everyday injuries that can happen. That can really add up. And especially as people age, these little, I fell down the stairs at, 30. I had a broken bone. I was fine. If I had made that same fall, right, at 65 or 70, that probably would have resulted in a pretty lengthy hospitalization, right, and more severe injuries. And so just wanted to explain, but that's an example with the accident. Cancer would work the same way. If somebody had a cancer policy, if they were then get diagnosed with cancer, they're going to get their treatment like they normally would. Insurance, Medicare, major medical, whatever type of insurance, that is between those funds, those coverages go to the provider. There's the purpose of those is to minimize financial risk. What Aflac does is give a financial, and I hate to use the word reward, but it allows them to receive benefits based off of their treatment. So they get diagnosed with cancer. There are set dollar amounts in our cancer policy that says, hey, if you've received, this type of surgery or chemotherapies or radiations or XYZ, there's a set dollar amount, very black and white. And then they're going to get that money sent directly to them, and then they can use that money however they want. The only one that's a little bit different, so I would say accident and cancer pay for the treatment. Our critical illness is even a little bit more simple. It pays for a diagnosis. So if they get diagnosed as having a heart attack or a stroke, they get a lump sum amount just for that diagnosis. Whereas accident and cancer pay based off of the treatment that they receive. And it doesn't matter what the treatment costs them. We have a set dollar amount for each treatment listed, and that's exactly what we're going to pay, regardless of who paid the bill, if the bill was paid at all. We don't get involved in that. So starting with the accident, and I know I spend a little bit of time going over that, but again, it's just because for that concept, I want to make sure everybody gets that, because once you understand that concept, those products really then become interchangeable. So just wanted to talk about that. There was a question in the Q&A about, are they subject to income taxes? That is a question I My official answer is they need to defer to their tax advisor. We cannot give tax advice as an insurance company. I will say, though, these are not disability or any forms of income. So there's nothing that says you have to be employed full time or it's based off wages or anything like that. So you can take that answer how you want, but the official answer would be they would need to talk to their tax advisor with that one. So I will say, if you read the tax code, because I used to work for H&R Block years ago and do taxes, it just says that you have to report any amount over the charges, not what you were charged, the actual cost. So 99.99% of the time, that's a no. So just got to read the tax code there, but refer them to a tax professional for that. So when we look at the accident policy, it can be sold to anybody between the ages of 18 to 75, with the exception of California and Mass. They cut it off at 64. But every other state, as long as the person is between 18 to 75, they can purchase the policy. Just like I had mentioned before, that age only is applicable for them to buy a policy. If they buy a policy at the age of 70, they can keep it past the age of 75. So nothing happens at age 75, except they become ineligible to purchase an accident plan if they don't already have one. So if a 70-year-old purchases the policy and lives for 30 years, he's going to have accident coverage for the next 30 years. We do not increase the premiums due to age. We also don't increase the premiums due to the number of claims. So, and the accident policy is not age banded. So the premiums are not age banded. So that 70-year-old is going to be paying the exact same for an accident plan as the 20-year-old in that state. So it's not, because the likelihood of somebody having an accident technically is the same for everybody. So the premiums, if you buy a policy at $25 a month at age 70, you're going to be paying that $25 a month for as long as you live. There are two accident plans to choose from. You're going to have a standard and an elite. The only difference, so there's nothing on the elite plan that is not also on the standard plan. The elite does cost a little bit more because it has higher payouts. So an example would be if you go to the emergency room or an urgent care because of an accident. If you have a standard plan, then Aflac will pay you $60 for that, just for that going to the emergency room or urgent care for that treatment. That's before any of the injuries themselves or other treatments. So just for showing up, it is $60 on a standard plan. On an elite plan, it would be $120. So some of the benefit amounts that Aflac will pay the individual are higher, which is why the premiums are a little bit higher. It's not with every benefit, and it's not always double, but it will give you in the platform, when you go into an accident plan, you don't have to choose standard or elite. You can just choose accident, and it will give you the side-by-side breakdown in price. So you can do that side-by-side comparison for all of the benefits and see which ones are different. The other thing with the accident that makes it kind of our universal plan is the fact there are no medical questions. In most states, there's only 3 questions. 2 are just making sure that they know it is not major medical and it's not intended to replace major medical or Medicare coverage. Second question is typically going to be something around the lines of, do you already have an accident policy with Aflac? The third question is still not medical, is a disqualifier. It's going to ask if they have had any type of DUI within the last 5 years. That's usually the only disqualifier. The wording can vary from state to state. Some states say, have you been charged? Some say, have you been convicted? Those can be 2 different scenarios based on how the question's worded, but it's traditionally something around having a DUI within the last 5 years. But that is it. We don't ask any medical questions. So when I say universal, especially if you are primarily in kind of that, Medicare range, it doesn't matter what type of diagnosis people have. And there's a lot of conditions that can make people actually more accident prone. So somebody could have a diagnosis of Parkinson's disease, of MS. Those are things that can make people more accident prone. We don't ask about that. Same with medications, right? If they're on medications that you look on the bottle and it's like may cause drowsiness or dizziness, chances are they may fall down. They may injure themselves. So it doesn't matter what medications they're on, what conditions they have. They're still going to be eligible for the accident policy. There's also no waiting period. So as soon as they sign up and they want their policy effective June 1st, if they're injured on June 1st, they're going to be covered. So there's no waiting period. And it does have 24/7 coverage. So it does cover injuries that occur on or off the job. So if somebody is injured while at work, even if it, is a workers' comp situation, they could still go through that workers' comp process with their employer. It's not going to interfere with that because we don't look at, well, who covered the treatment, who paid for the treatment. Was it covered by insurance? Was it covered by workers' comp insurance? Was it covered by, we don't look at that. We just verified that the insured individual had treatment because of an accident that we covered. And then we pay that individual whatever dollar amount it says for that treatment. All of those other scenarios are between the primary insurance and the provider, are between Medicare and the provider, are between the workers' comp insurance company and the provider. We don't do anything with the provider except verify this person did in fact receive treatment. And that treatment was because of an accident. So that 24/7 coverage is going to cover accidents that occur, holidays, weeknights, weekends. If they're on the job, get injured. I had a random question. Somebody's like, well, one of my customers retired and is a greeter at Walmart, and he got his foot got broken, ran over a cart. I don't remember the situation, but it ended up being covered, right? Because it did happen while I was at work. It was still an injury, an accidental injury. So they were able to file that under the Aflac accident policy as well. So with our policy as well, there is no policy maximum. There are some benefits that will have limits, but those limits are typically going to be like per accident or per calendar year. That will also clearly be listed when you go into the platform, when you're looking, at the full benefit list. It will tell you in the description, hey, there's a maximum of, 6 of these per accident. So it will always let you know if there is a maximum. It is not a lump sum policy. We call that out because there are lump sum accident policies on the market. We want to make sure that we don't describe it as this. There's no way for us to know how much an accident policy will pay someone until they submit a claim. There's absolutely no way because it's going to be based off the type and severity of their injury and then what the treatments were. It could be as little as $60. It could be $60,000. So there's no way to know, and there's no minimum, but there's also no maximum. So they just have to submit that claim and see. Now, if they did like I did, I pulled up my policy when I broke my foot and went through and said, how much am I going to get from my policy, right? Because you can look at the benefits, it lists a dollar amount, and I actually came in $40 under what they sent me. So I just went with it. Nobody complains if they get paid more than they expect. The pricing we said was the same for everybody. There are no medical questions. And then we talked about children can be covered to the age of 26 on all policies. So that's it with the accident. It is the most universal plan that we have for those reasons. Next, we're going to talk about cancer. And cancer is our most popular and oldest product that we offer. Aflac was really the pioneer when it came to cancer policies. If you were to look at all cancer policies on the market today and do a side-by-side comparison, you will see that the Aflac cancer policy outshines any other cancer policy on the market when it comes to the types of benefits, the amounts that are out there. And I say that just because in full transparency, there are some very similar accident policies on the market. There's some very similar critical illnesses, but Aflac's kind of pride and joy is the cancer. So you're not going to find a better one on the market, especially at the price point. So with the cancer policy, it can be sold to anybody between the ages of 18 to 69. Again, California and Massachusetts have to be difficult. They cut it off at 64, as well as North Carolina for the cancer. But in most states, it can be sold up to the age of 69. Now, nothing happens past the age of 69 if they already have a policy. Just like with the accident, that guaranteed renewable for life means if a 68-year-old person in Georgia buys the policy and lives 30, 40 more years, their cancer policy will remain intact. So it doesn't, 18 to 69 is not the coverage age, it is just the issue age. So as long as they buy it between that age, they can keep it as long as they like. There are 3 options with the cancer. You're going to have standard, plus, and elite. The standard plans start as little as $20 a month per individual. Just like with the accident, there were 2 plan options. Here we have 3. I call them small, medium, and large because maybe I eat too much fast food. But I think of it as if you go through a drive-through and you order a value meal, they're going to say, do you want, what size do you want, small, medium, and large? All 3 of those come with the entree, like the sandwich, the fries, and the drink. It is just the amount of fries and drink that you get. So with our cancer plan, all 3 come with the same benefits. It is just the plus and the elite, which is the medium and the large, have higher price points because the payout amounts are higher. But there's nothing that they say, oh, I want to have coverage for radiation. That's covered under all 3 plans. They're not forced to buy an elite plan to get that benefit. So all 3 plans have the exact same coverages, but the plus and the elite will pay out more for certain treatments. So that's why the price points are what they are. All cancer coverage has a 30-day waiting period from the effective date. I cannot give you legal advice or tell you what to do. However, I will say what I used to do is if I sold somebody a cancer policy and it was going to go into effect June 1st, I just told them don't even step foot into a doctor's office before July 1st. So the 30-day waiting period applies to all cancer coverages. So it is 30 days from the effective date. So if somebody had a June 1st policy effective date, I told them you have the cancer policy, but don't even schedule the appointment until July. Call on July to schedule the appointment and go sometime after July 1st to make sure that they're past that 30-day waiting period. It is available in most states. Again, always check the platform because that can change. And then the coverage options are going to be the same. Also with our cancer policy, one thing, and just based off your demographic, it may not be as big of a deal, but you still may talk to somebody who does have kids at home. This is just for the cancer policy, but dependent children are covered under the policy at absolutely no cost. And I say, your demographic, but you may be interested in a cancer policy. But on the cancer policy, children are covered at absolutely no cost. So if you were to quote an individual elite plan and a single parent family elite plan, you'll notice that the price is the exact same. Also, some of the benefits, such as the initial diagnosis and hospitalization, those benefits are higher if it is the child that is going through the cancer treatment. So, for example, the cancer plans have what's called an initial diagnosis benefit, which is just for getting a diagnosis, like a pathology report that shows the presence of internal cancer. Depending on which plan you have, let's say you had the elite plan. That's a $5,000 payout just for the diagnosis before you even look at any of the treatments. If it is a child that is diagnosed, then that doubles to $10,000 just for being diagnosed. And then there are benefits for all of the treatments, whether it's radiations, chemotherapies, surgeries, but it doesn't pay just for the treatment. There are benefits for screenings. We want people to get screened. So there are cancer screening benefits that can be filed regardless of the results. Like the goal is we want everybody to file the cancer screening, and we want all of those results to be negative, but they could still get, the cancer screening benefit. So for example, I believe it's the plus, and I'm working off memory here, but if you guys, and I'll make sure that I check with Ben, but we should have the links that go into the training links for the products that go into more of the specifics. But let's say there's a $75 benefit for cancer screening. If somebody goes and gets a mammogram, which should be covered at 100%, should be nothing out of pocket to them. Their mammogram comes back free and clear, no abnormalities, anything like that. They shouldn't have paid anything out of cost for that mammogram, but then they can submit that under their annual screening and get paid $75 from Aflac for going to get that. In the event then that the mammogram does come back, right, and then there is cancer, then the actual cancer diagnosis and treatment benefits would kick in. So the benefits aren't necessarily just for the treatment of cancer. There's benefits for the actual prevention and screenings for cancer, as well as recovery benefits and those types of things. It's not uncommon, depending on the stage and the type of cancer. It's not that uncommon a lot of times for our cancer policy payouts to get well into the six figures in there. So we talked about children are covered at no cost, the 30-day waiting period. There's no policy maximum. Some of the benefits are going to have limits, just like with the accident, but those are going to be clearly defined. Also with the cancer plan, that initial diagnosis we talked about, that is for internal cancer. There are benefits for skin cancer, but that, say that initial diagnosis in the scenario I gave was $5,000. That would not be paid for a skin cancer diagnosis. It would have to be an internal diagnosis. The two main points I want to talk about here is that any diagnosis or treatment outside of the U.S. for the cancer policy is not covered. So if they went to Mexico or Canada or somewhere in Europe, maybe there was experimental treatment or the treatment was cheaper, they absolutely could go there. They just could not file those treatments on the cancer policy. However, treatment in any U.S. government hospital is covered regardless of where that hospital is. So worldwide, if they're getting treatment at a U.S. government hospital, it is covered. Another scenario I use with the government hospital too is the fact that if it is let's say a retired military veteran, maybe they were diagnosed with cancer, but they're going through treatment at their VA hospital. A VA is a government hospital. So if they're going through cancer treatments at their VA, hopefully the cost should be, really minimal. Their out-of-pocket expenses for that should be, hardly anything. If there are costs, minimal. They would still be able to file whatever treatments they received on their cancer policy. Right? I always use the same example if just because you see the commercials all the time, right? If somebody has this policy, they're covering their kids on it, and their child ends up at, let's say, St. Jude for treatment. If you watch the commercials, St. Jude, they don't charge anything, but they still provide treatment. They would still be able to file that treatment under their cancer policy and get the same cash benefits. So we don't look at what was the cost. These are not reimbursement type policies. The indemnity means we have a set amount that we pay for the treatment. And so that's exactly what these policies will pay. The last thing I'll say about the cancer is, it can be sold to anybody between the ages of 18 to 69 in most states. If they make it, right, to, 60, 65, 68, 69, and they've never had cancer, oh, good for them. Amazing. It's a great policy. But especially as people age, the question they're going to have is, what if I've had cancer before? Can I still get a policy? Or they'll say, I wish I would have had that policy when I had cancer before. Having cancer before does not automatically disqualify somebody from getting a cancer policy. But if they have previously had cancer, they do have to meet all three of the conditions that you see here. So now these three conditions only apply if somebody previously had cancer. If you're talking to somebody and they say, I've never had cancer, And the next sentence is, but I've never been tested for cancer. That's fine. Right? These only apply to people that have previously been diagnosed with cancer. One is, the first condition is they have to be cancer treatment free for at least 10 years. So if they have not been treatment free for at least 10 years, they're not going to be eligible. Next is, but if they have been, right, if they say, yeah, I got my last treatment, 15 years ago, all right, check that box. Then they have to have had a negative cancer screening, any type of cancer screening within the last 12 months. So have they had any type of screening? It could be a pap smear, it could be a mammogram, it could be a PSA, any type of internal cancer screening that was negative in the last 12 months, we need that. And then they cannot be on any type of preventative hormonal therapy for at least the last 12 months. So if they meet those three conditions, right, they're not on preventative hormonal therapy for the last year, they have had a cancer screening with a negative result in the last year, and it's been more than 10 years since their last cancer treatment, they are eligible to apply. Their premiums are going to be the same. Their benefits are going to be the same. So it's going to be the exact same. We don't penalize them. We don't charge them more. Those are the conditions that have to be met if somebody did have cancer before. And then moving into the lump sum critical illness. This one is the quickest and the absolute easiest because, as I mentioned before, where accident and cancer have set dollar amounts and paid based off of the treatment. So the amount somebody can get could vary. When I fell and broke my foot, I got about $800. If I was in a really, really bad car accident and required surgeries or hospitalizations, I could get, closer to $80,000 or $8,000. It just depends. With the lump sum critical illness, there is no guesswork, right? There is no variation in how much somebody's going to receive. If they are diagnosed with a covered critical illness, they are going to get whatever amount they signed up for, whether that's 10, 15, 20, or 25,000. That lump sum amount is direct deposited directly to them, and they can use that money however they want. It's 18 to 69, just like with the cancer, 64, California, Massachusetts, and North Carolina. But just like with those, that guaranteed renewable for life. So if they already have a policy, nothing happens when they turn 70. The premiums don't decrease, or the premiums don't increase. The benefits don't decrease. It is the exact same policy that they've had since they bought it. They just have to be between under 69 or 69 or under to purchase it. But once they have it for life. Also, there are 4 face amounts. Depending on the state, you may see 3. You may only see 10, 15, 20. But again, always go to the actual enrollment site, to the site, put in the state and their age, and it will show you exactly what is available based off of their age and that state. But in most states, you'll see those 4 plan options. If all of these, just like with the cancer, there's going to be some underwriting questions involved. The $10,000 amount, though, has less restrictive underwriting than the other amounts, right? And I'll give you an example here. Now, 15, 20, and 25, the questions are identical, right? So if somebody can qualify or they answer all the questions as no, at the 15,000, they could also get a 20 or 25,000. Only difference would be price point, really. So 15, 20, 25 applications are identical when it comes to the underwriting questions. But one example may be on the $15, $20, and $25,000 amounts, it asks questions like, are you taking medication for hypertension or high blood pressure? Right? If they say yes, they're on blood pressure medications, that's a knockout question for 15, 20, and 25. It does not ask about blood pressure at the $10,000 level. Another one could be diabetes. They're going to ask, hey, are you diabetic? if they're diabetic, that disqualifies them for 15, 20, or 25. It does not ask about that at the 10,000. So I point that out because if you're talking to somebody and you know they have some, fairly serious or, blood pressure, diabetes, COPD, like chronic conditions, you may just want to start at the $10,000 level to see if they qualify. Maybe you're talking to somebody and they haven't made that clear, and they're interested in, let's say, a 15 or a 20,000. If you're in that application and it comes to light, they answer one of the questions, yes, it will stop you then and there and say they're not eligible for coverage, right? Because all of our eligibility questions are really knockout questions. So if you're in a 15 or higher face amount, and one of the questions is yes, it's going to immediately stop you and say, unfortunately, they're not eligible for coverage. All you have to do then, or what I would recommend doing, is just hitting the back button, changing it to a $10,000 amount, and see if they could qualify with those questions. Because while they may not be eligible for 15 or higher, they could still be eligible for that $10,000 amount. With critical illness, it will give you the option to include cancer. If you do choose to include cancer, the 30-day waiting period does apply to the cancer portion of that as well. There's no way to get around a 30-day waiting period for cancer coverage. It does not extend 30-day waiting period to other covered critical illnesses, such as heart attack or stroke. Also, a few things around including cancer with critical illness is going to be, it's usually, in most cases, it's usually cheaper to do a standalone cancer policy as opposed to including cancer as a covered critical illness. I'm not an actuary. I don't know why, but that's just how the pricing came out. The other thing is if somebody uses tobacco or nicotine products, I do not recommend putting cancer on their critical illness. Just put them in a standalone cancer plan. The reason for that is, for whatever reason, we don't ask if the person uses tobacco or nicotine on our cancer applications, right? So it's the same price for our cancer policy for somebody who's never smoked as it is for somebody who smokes a pack a day. Right? We don't ask about cancer or nicotine or tobacco on the cancer policy. Don't know why, just always kind of behooved me, but I just went with it. We do ask that question on the critical illness, and it does impact the rates. So, if somebody does use tobacco or nicotine, they can still get a critical illness, but it's going to be higher. So for that, that's why I say if somebody uses tobacco or nicotine, or the answer to that question is yes, I would not recommend including cancer, because they're going to be paying more money to include cancer than they would if they just did a standalone cancer plan. If for some reason you had a situation where somebody wanted to include cancer on the critical illness and also have a standalone cancer plan, they could. That's absolutely okay. Now they're going to be paying for both, but they would also receive the full benefits from both. So they would be paid from their critical illness for the actual diagnosis, and then paid for the diagnosis on their cancer policy, and then all of the treatments they could file under their cancer policy as well. It would not be cheap, but if somebody's in that financial situation, it's not my call, it's theirs, but they can have coverage under both plans if they would like to. I'll say the last thing with the cancer is the initial diagnosis. So that 10, 15, 20, 25, that's only payable once per lifetime. It is for each covered person, though. If you look at most lump sum critical illnesses, that face amount only is payable to the primary insured. Their spouse may be covered at a reduced amount. Ours is the full face amount for each covered person, but there are subsequent event benefits. So it's not like a one and done. So that face amount, that 10, 15, 20, 25 is only payable once per person per lifetime. But if they were to have other events, it could be the exact same event they had the first time or a different covered event, they would receive 50% of whatever that face amount was. So if they just signed up for, let's say, the $10,000 critical illness plan, the first time they had a covered illness, and one of those covered illnesses are the ones you see on the screen there. Say they had a heart attack, they would get the $10,000. If, as long as it's more than 6 months later, 180 days later, they then either had a second heart attack, they would get 5,000. Or let's say, 7 months later, they had a stroke, it would be 5,000. And there's no maximum, there's no limit on the number of times we will pay the subsequent event illness benefit. So the 50% amount is payable for as long as they keep the policy with no maximum, as long as it was at least 180 days from the last event that happened. And it could be the exact same event, a different event. It's just, we kind of look at all of them as the same. So that is where we are. I think I got us in. I'm 2 minutes over, so apologies for that. I get a little talky too much in there, but that is all I had. I was checking. I didn't see any other questions in the chat or Q&A, but I am more than happy to answer any questions that you guys may have. There's a lot of information.
Yeah, I was going to say thanks for that, Sam. That was a lot of information. Appreciate you guys and Aflac for the partnership and just coming on and presenting some of these products for us. There was one question about the PowerPoint slides, if they're going to be available. I don't know if that's, I know I saw that they're for training purposes only, so I don't know how you guys, operate with that. So that was one of the questions, though. That was early on. Don't know how you want to.
Yeah, usually what I do is, what I'll do, Ben, is I will probably send it to you. I'll send it to you. Usually I have to do it in like a PDF format.
Okay.
And then you can share it or post it or utilize it however you want to.
Cool.
I absolutely, and I'll make sure to, were you able to share, do the agents have the links to the online trainings for the products?
We have them,
Okay.
but on our website we have, because I was looking to when you were presenting there, we have all the brochures and stuff with like the premiums and things like that for the cancer products. So I saw that on our website. So, but we do have the links too. I can get them out to the agents that were on the webinar today. Get that over to them.
What I'll do is I will include, I'm making myself a list here because I don't trust my brain at all.
Yeah.
But I'll send a copy of the training deck. I'll re-include those links. And then I'll also include, we have an agent resource site now that has, it's still under construction. So if you guys go to it, on some of the content, it'll say, coming soon. But we did get, it's probably like 60% there, but I try to get at least one piece because I have to go through compliance and all that fun stuff. So I try to get at least one thing uploaded per week. But there's a lot of tip sheets, like the brochures, that type of information, especially around the enrollment platform. But I'll send you the link to that agent resource site as well. And that's where they can get even more product information, tips, those types of things as well.
Sweet. Yeah.
Hey, Sam and Ben, I just wanted to add and remind the agents that there's a contest from May 30th through June 13th. It's a really good contest. It's $20 per app with some milestones. So if you write up to like 5 apps, you'll get a total of $200. So it's an additional $20 per app. Oh, nice. If you write up to 10 apps, you'll still get the $20 for the 10th app, but you'll get an additional $100. So you could get up to like 400. If you write 20 apps, you can get up to a total of $950 and I think it's Amazon gift cards. So it's a really exciting contest for any products that are written for the accident, cancer, critical illness, and dental. So just wanted to jump on and remind the agents of that contest as well. It's starting on the 30th.
Yeah, that's awesome. And that's exclusive to URL. So I would, so that's, we appreciate that. And that's exciting. I mean, that's a good deal right there. So we
I'm happy to share my Amazon wish list with anybody who is interested. I'm happy to make that wish list public.
Yeah, there you go. There you go. So thanks for that, Rachel. Appreciate you bringing that up because I almost forgot about that. So appreciate that. Sam, anything else you want to say before we exit here?
That's all I had. Like I said, I'll get the links over to you for just the product and the platform, and then a copy of this training deck as well. The biggest thing is make sure, even if you have it pulled up, make sure that you're comfortable getting to our enrollment platform, because it's, and trust me, in 24 years I've been doing this, I've worked on almost every platform imaginable to man. This one is designed for like call center agents. So most of the time you have to like know the secret knock and handshake and the right click, left click. With ours, you choose the state, you put in their age, and you immediately see there's tiles, right? So you could click on accident, cancer, critical illness. But I say that because pricings can change, although it's not common, but benefits can vary. So just always try to make sure that you're going to that platform if you're talking about the benefits, if you're talking about the price, just to make sure they don't come back and say, well, the agent, they told me want this and that. And they did live in a state that did have those kind of different specifications.
Gotcha.
So that's the fun part about call center agents is,
Yeah.
when I did it was face to face. So it was like, no, I know the states, where I'm talking to you in. The call center, there can be some variation, with those, with them. So it's a very user-friendly system. Like I said, you don't have to put in any of their information to get that far. It's all the benefit and pricing is available to you with state and age. So
Okay, cool. Good
all
to
right.
know. Good to know.
Yeah.
Awesome. We appreciate it.
Yeah.
Like I said, a learning experience for me too. So appreciate, jumping on, and I'll probably be in touch with you.
Yeah. If you have any questions or need anything else, or like, hey, do you happen to have this? Just reach out. We're happy to help in any way we can.
Yeah, awesome. Appreciate you guys being here.
Thank
Thanks,
you.
Aflac. Yep. Take care.
Thanks. Bye.